Hello, my name is Neeraj Dayama. I'm an assistant professor of healthcare management and leadership at Texas Tech University Health Science Center. So this study is about looking at the five-star rating system in our Texas nursing homes. So as we know, five-star rating is one of the most commonly used rating systems for quality and also transparency that was initiated by our regulating agencies like CMS, and so there has been a lot of, well, it has been out for more than a decade now. And every year these star ratings get updated on the CMS nursing home comparator website. So typically, one-star nursing homes are regarded as the poorest quality of nursing homes rated poorly, and five-star is supposed to be the top rated nursing home. So we are trying to use this information and trying to examine what would be the nursing home factors, characteristics that are associated with falling in a five-star versus one-star. Now, whether five-star rating system is an ideal quality metric rating system is also not. That's another question, because there's Google ratings, there's five-star ratings, and there's also nursing home quality metrics rating system, which is the MDS quality reporting system. So we look at the more five-star, which is one of the most widely used quality reporting system, and we looked at the data between 2016 and 2021, and that data was linked with nursing homes organizational market characteristics from LTC Focus, and the data on five-star rating was downloaded from the CMS Nursing Home Compare. And we also looked at some market characteristics to understand what kind of environment these nursing homes are in. Specifically, the market means the county would be the geographic area. We looked at that, the characteristics of the county. So that data was downloaded from the AHRF, the RUCA codes, and the rural urban commuting codes, and also the US Census Bureau was used to download some other market attributes. Now we first had all the five-star rating nursing homes across all the five stars, but our goal is to compare nursing homes with one star and five stars. So we performed some descriptive analysis and also adjusted panel data regression with fixed effects to see what nursing homes are, to estimate the effects of these factors. So we found that most of the nursing homes in the poorly performing group were for profit. They were chain affiliated, and they were bigger. The bed size was more, and also they had low registered nurse and CNA count full-time hours available per resident. Also, the acuity index, which is a measure of all the chronic diseases of the nursing home residents, it's an average measure. It suggested that the nursing homes in the one-star group had more percentage of sicker residents, and also a higher proportion of minorities compared to one-star nursing homes. Sorry, compared to the five-star nursing homes. For example, in the one-star group, there were 19.3% Hispanic residents versus 8.8% in the five-star group. Also, the proportion of white residents in five-star group was about 80%, whereas in the one-star group it was 62%. Also, the market characteristics, the affluence level of the market, which is from the per capita income, was much higher in the five-star rating nursing home group. Also, a greater percentage of these one-star nursing homes were in a rural area compared to the five-star group. On adjusted analysis, we found that for-profit association, larger bed count, higher bed count, lower RN hours, lower registered nurse availability, lower CNA availability, and higher Medicaid census. So these nursing homes also had a higher percentage of residents on Medicaid. All these factors were still remained associated with um, likelihood of 1-star rating. Also, but for the market factors, per capita income remained. So the neighborhood income, the income average income of the county per capita per residence remained one of the significant factors that determined whether that nursing home was in a 1-star rating neighborhood. So some of the explanations is that for-profit chain affiliated nursing homes could face corporate pressures that affect their operational decisions and that may hamper with quality of care. And this finding has been consistent with prior literature and reports from the government, from GAO and regulatory bodies, and also CMS. The other thing is that smaller facilities may have advantage with personalized care, which is a better quality of care, and also the association that RN staffing and sicker patients in um, 1-star nursing homes is kind of interrelated, and there may be an interaction term may actually determine their combined effects. Also, race and ethnicity remains one of the major determining factors for poor 5-star rating. So the study did not find a significant association with rural location in the adjusted model, and that could be because of we used the RUCA codes, the primary RUCA codes for the study. A more granular measure like secondary RUCA codes should be explored, but that's challenging because the secondary RUCA codes they have a more granular geocode, and applying it to county level could be challenging. So, in conclusion, our study affirms the need for targeted interventions aimed at improving the condition and quality of care within these 1-star Texas nursing homes, and as we determine the factors that are associated with this finding. So there needs to be a reform in the long-term care sector driven from the policymakers and regulating agency, taking into account ownership, staffing levels, insurance, and disparities on how to help these nursing homes who are performing poorly on the 5-star rating system. So that's it with this presentation. If you have any questions, please reach out to me on my email address. Thank you.